All right, guys, welcome back to the Adam Peter Fitness podcast. Today, Mircea is back on the show to talk about two healing peptides, BPC 157 and TB500. These are really popular right now, and I mean, I've used them in the past for some of my injuries. I think that people just know, oh, BPC 157, TB500, they do something for injuries, but they don't really know how they work. So I guess I wanted to Labir talk little bit about, how basically BBC and TVB 500 got created and how they work to start off.
Well, the fact that you started with how they got created, that's an interesting statement because most things we use today were not created. They were not invented. They were discovered. Most of the PEDs, they were discovered sometimes purely by accident. So starting with, let's say, BPC, BPC 157 is a synthetic version of something called body protection compound, an actual peptide hormone that is found in gastric acid. So in your stomach acid. Um, what this peptide does, it's a 15 amino acid peptide. What it does, it promotes healing through three main mechanisms. The first one is angiogenesis, which is just creating new blood tissue, including blood cells and vascular tissue like small veins, capillaries, etc. So it acts as an angiogenic compound. Then it also acts by releasing nitric oxide, which relaxes the blood vessels, further increasing blood flow to areas that are affected by whatever. And then also it promotes the creation of new growth factors. Some of them would be, for example, VEGF, vascular endothelial growth factor. The endothelium is the lining within the red blood cells and lymph cells. So if you're talking about blood cell endothelium, that is literally the lining of the inside of red blood cells. So we have a compound that works primarily by increasing blood and blood flow. Now, this will lead to a few things, including, better transportation of nutrients, better oxygenation, of course, some anti-inflammatory properties, just pure through these growth factors, healing properties, and even some mild pain relief. BPC acts on the gut tissue as well. I believe the oral version of BPC is being, if not studied, if not used, then at least studied. But I know some biohackers use an oral BPC to alleviate symptoms of basically GI distress, but most importantly, Crohn's disease. And I am working with two people that do have Crohn's, and they have reported very, very potent benefits from taking oral BPC, which is interesting considering that this originates in your gut. It's from gastric juices. It's interesting that taken orally actually helps the actual um, tissue affected by Crohn's disease. TB500, on the other hand, that's very similarly to BPC. It is thymosin beta 4. It's that thymosin beta 4 is a 43 amino acid peptide found in pretty much every cell in your body except red blood cells. Um, the TB500 is just the part of this amino acid chain that is responsible for healing. And this acts in very similar way in that angiogenic pathway as BPC. The difference is that it also promotes the synthesis of a protein called actin. You might have heard of
Hmm.
actin from actin myosin cross bridging, muscle contractions, etc. It is that actin, which is a structural protein and is basically the foundation of every cell in your body. There's different subtypes of actin, of course, and I believe it is actin F that is part of the actin myosin cross bridging in muscle tissue and skeletal muscle tissue. But there are different subtypes of actin. And TB500 doesn't work the same way on gut tissue. Some people would say that TB500 is better at recovering, just to stay on topic with healing and recovering soft tissue, muscle tissue, skin tissue, while BPC is more of a gut healing peptide. I really think it's far beyond the gut. I think it also is on muscle, on skin, but I find it's very potent on soft tissue like tendons, ligaments, and also bone. Very interestingly, it is
Mm.
actually good at healing even bone tissue. So these two peptides work to complement each other and also synergistically. In practical application, I find the TB500 is, in my opinion and experience, of course, better at driving that um, angiogenic pathway, basically creating an infrastructure to drive blood and nutrients to a wounded area. And BPC is the actual healing compound or the derivatives of BPC, all the growth factors that get synthesized by the presence of BPC. I think that is the way I would frame the synergy between the two and how I would use the two. Of course, I think that both work very well, even in isolation. You can take just TB or you can take just BPC. For gut healing purposes, I think that you just need BPC, and probably the better option would be the oral version. And you'll hear a lot of people say that BPC is very potent at healing pretty much everything. I've heard people say that they take BPC and it helps them heal damaged kidneys. Basically, people
Mm.
that have impaired kidney function. Some have said that they have noticed an improvement in their EGFR just from the presence of daily BPC, subcutaneous or intramuscular, or weekly or biweekly intravenous. There's been so many ways to use these compounds. People like the quote daily dosing with BPC, sometimes twice daily because it has a pretty short half-life. Bolus doses have been shown to be more effective in a once a week kind of application. So we're talking about 5 milligrams of BPC instead of 250 to 500 micrograms, 5 milligrams once a week to an IV drip. TB500, I've seen good results with using it once a week at about 1 milligram. Some people say that it has a 1 to 2 day half-life, so it's an every other day application. I find that that's a bit overkill. Once a week is just fine. And they're both systemic. PPC does have some localized effects, so injecting it close to the injured area has maybe a 5% benefit over just injecting it anywhere. TB500, on the other hand, is just systemic. It has pretty much no benefit injected locally. But BPC is interesting because I've seen some formulations used on open wounds. So it's kind of like a cream, and you put it on open wound to minimize scarring. Now, again, that gets into it's an open wound, so it gets into the bloodstream to the wound. It doesn't act like a GHKCU copper peptide cream, which actually can pass the dermal barrier.
So I guess you already mentioned like, you don't have to have it be localized. There are some formulations of these compounds on peptides that are nasal sprays and not
Mhm.
injectable. I've always like been a little bit sus about that. Is that going to work in a very similar manner to actually injecting the compound, or is that just not as useful? I'm sure there's obviously there's differences in bioavailability between like injecting something versus taking a pill versus a nasal spray. Um, but well, what are your thoughts on that?
Oh, well, nasal administration is super effective. It actually, it can cross the blood-brain barrier ease with more ease. Yes, I find it's very effective. I personally think an injection would be better for various reasons, including, just um, more or less measurements, actually getting the exact quantity you want uh, per vial, per, unit ml. I think it's a bit more precise. The nasal spray, it works just fine. I think it's more of a convenience issue and a stigma. Like a lot of people just don't want to pin themselves twice a day. And it's easier for them to have just like, oh, I have this nasal spray. I'm just gonna put 2 puffs in my nostrils and that's it. It should be as effective as a subcutaneous injection. I don't see any loss in effectiveness. It's more convenient. You just have like this little spray thing in your pocket, and you can do it twice a day, rather than just walking around with a loaded insulin syringe. It does have benefits, but in my opinion, I would just go with the classic, injection via insulin syringe, subcutaneous. If you want some muscle, that's fine. Um, and abide by whatever dosing schedule you can, you can tolerate, let's say. I think for if you're looking for the best results, you'd probably want to do BPC twice daily. Once a day is perfectly fine. And with the TB500, I would go with just once a week. I don't think that the whole, every other day, 3 times a week, whatever, I think it's just unnecessary.
Yeah, the interesting thing about the synergy going back to that is that I tried taking like BPC 157 like for like my lap or like like OPEC minor strains and did nothing really happen until I put it in like TB 500 and that was like kind of like the catalyst. So like when you talk about a little more about the muscle stuff definitely is a really helpful compound. I think that one strategy that you see a lot of enhanced strength athletes using is that when they're getting to their heavier lifting, where there's a lot more orthopedic stress, they will sometimes prophylactically take BPC 11557 and or TB 500, sort of to help out with their tendons and whatnot. I know that John Hack has gone on record about that. Do you think that's a good like a viable strategy? Like that obviously the main thing I'm always going to tell my clients this is you need to not train like an idiot to actually make it to platform in one stage, but powerlifting is hard. Strongman is hard. So is there any merit to, maybe just saying, I'm 8 weeks out, I'm going to start taking these every day or every week, in the way that you described?
Yes, I actually do believe that. Yes, they're called healing peptides for a reason, but I think that they're also very good at bulletproofing you against future potential injury. Yes. So, for example, if you're getting ready for a powerlifting meet, taking TB and BPC 5, 6, 8 weeks out just to make sure that you're going into the meet without any injuries, and you're also not going to injure yourself on the platform. I think that's a great idea. Also, if you're, let's say, you don't have a planned meet, but you have a very heavy strength phase coming up, it might be a good idea to front load, something like the end of the hypertrophy phase or that transmutation phase between hypertrophy and strength with some TB and BPC. So by the time you reach peak strength, you're already, have, let's say, saturated levels of TB and BPC. So you've already bulletproofed yourself against the injury potential from higher and higher loads. I think that's a great idea. It would be proactive, in this situation. So I wouldn't do it maybe at the same time as the strength phase, but I would maybe do it before starting a strength phase. And then, again, when you're injured, depends on the injury. If you have like a small tear, either muscular or tendon tear, you can use that then and there. If you're recovering from a surgery, like you tore your pec tendon clean off the bone, you had surgery, I would give it a bit of time to heal on its own because um let's say you have a limited range of motion, you're bunched up like this. Let the wound start to heal, let yourself recover some range of motion before adding them in because they will accelerate healing. If you, let's say, if you have your hand in a cast in this like 90-degree position, if you accelerate the healing to the point where it by the time your cast is off, you're fully healed, you might only have this range of motion left because your
Right.
tendons have gotten really strong in a really shortened position. And now, literally, to go to a full range of motion of the joint, you would literally have to tear your tendon again. And now you're probably dealing with maybe an even stronger tendons, which is that's a bad thing. That's a
Yeah.
bad problem to have.
Yeah, I mean, I think that I remember Broderick saying that it makes sense to like use these compounds in a phase where you're not beating yourself up, ideally, because you know, we always forget that, connective tissue is that forgotten tissue, and that is really, truly, like most of the time, the limiting factor. And most people like a lot of people like, oh, I think I'm like sore in my muscles, and it's like it's probably not related to that, especially if you're training on PEDs and um, it's probably mostly that you're connective tissue, being irritated. And I could tell from myself, like if my tendons don't feel good, it's like my body just is not going to let me produce maximal force. And I think especially like when you are like going into a heavier, lifting, I think it's kind of about knowing yourself too. Like, am I the type of person where this is recurringly like an issue? And then if you do notice like, hey, this actually is a limiting factor, and I notice that, I can, after X weeks of, heavier strength training, I just get these aches, pains, tweaks, or I just find that it's just hard for me to consistently gain strength along with the PDs because, like, when you think about it, it's like if you are taking, a good amount of drugs for you to, gain muscle and strength, and then your body weight's going up, and you're getting stronger, like you're going to need to have something to sort of help out with that remodeling of tendons to help out with it. So I think, combining, TB500 BPC, and if you have the finances for, even HGH, help them just move, work even better because correct me if I'm wrong, I believe that growth hormone basically just, it just helps everything like work better. And so it's like, you're taking, 1 gram of anabolics, it works better. Just like, you're taking your BPC in the TB500, you get more out of it.
Absolutely. And it's a good thing you mentioned growth hormone and the analogy of anabolics, anabolic androgenic steroids. They will help your muscles to repair, recover, and grow. Yes, but they don't do much of anything for your tendons. So something like, you put a really powerful engine in your car, but you leave like like the wheels of a, Honda Civic, and you have the engine of a Ferrari. Like you have like a V10 engine and the wheels of a car that won't go more than, 80 miles an hour. So, you need to change other parts as well. Or in the case of your body, you need to augment other systems too. Sometimes, if you look at somebody who's enhanced at the high level, they might need extra thyroid, they might need extra insulin, they might need, extra growth hormone to protect those tendons, those ligaments. And growth hormone, also improves immune function, also aids in repair and recovery of skin cells, and as you said, pretty much everything. The growth factors that get derived from actual growth hormone, those do all the repair, recover, and everything else. So, talking about the growth factors that you get from BPC, the growth factors that you get from growth hormone kind of synergize, and also that initial pass to the bloodstream of growth hormone, which stimulates the release of substrates. You get the substrates, you get the growth factors from growth hormone, and you also get the growth factors from BPC. Now you also get the enhanced blood flow. So you have enhanced blood flow driving nutrients to the muscle. You have signaling hormones that signal repair, recover, rebuild, build more, whatever. And you also have the substrates in your bloodstream, which, your triglycerides and your glucose. So now you have material to repair, and you have the signaling hormones that signal repair, and also a good method of transporting them to the site of where you're injured. So it's it's a synergy. Yes, growth hormone does help a lot with this. Um, I think that growth hormone is kind of like your baseline, something that you can take year round. But of course, in varying doses, if depending on your finances and so on. And then BPC and TB are the things that you would take sporadically, sometime, depending on what kind of athlete you are. Yes, you would take it maybe to bulletproof yourself, before a big event to avoid injury, or you take it if you get injured to heal yourself faster. Um, I wouldn't use TB and BPC year round just because they work. They work really well. And anything that would have healing effects would also have, let's say, hypertrophic effects. For example, BPC is, as I mentioned, is known to work also on bone tissue. So if you have a small bone spurt, BPC doesn't distinguish that from, your normal bone structure. It's like, oh, this is more bone, so let's grow the bone that may include growing the bone spurt, which is a really bad thing.
Yeah.
Same thing with, angiogenic properties. You might run into the high red blood cell concentration. You might run into pretty innervated places that should not be innervated. You don't want to have a lot of vascular tissue in your joints where this is happening nonstop, where you can crush, that's why you don't have a lot of vascular tissue in your joints because the constant movement can crush those vascular, that tissue and cause internal bleeding. It's by design. Um, Also, if they work on healing, repairing heart tissue, that might also lead to hypertrophying heart tissue, which doesn't happen very often, but it's also something you don't want to have an enlarged heart.
Right.
It's a risk that some people say like, oh, it just can't happen. It's not true, but again, I wouldn't risk it. I don't see the benefits of taking them year round when there are certain risks. And um, of course, there are people, as I mentioned, that would take VPC to heal other types of, I won't even call them injuries, but renal issues. And they have reported that to work. And it's also kind of like, okay, you have messed up kidneys. What's more important? Avoiding dialysis or risking having an enlarged heart
Yeah.
or a few extra bone spurs? Like, yes, just like any medication. No
I
drugs
think
are
it's
good for you, but you know,
like, especially if we're talking about something like, cardiac hypertrophy, like, correct me if I'm wrong, like in a scenario like that, it's like, it's kind of like with anabolics. It's like, it's the chronic use of anabolics of being a higher body weight or, and other risk factors that will like actually lead to like that significant and like long-term cardiac hypertrophy if you're taking something for like, maybe like, a few months or, say, however long it takes for you to reverse the dialysis. Like, my assumption would be like any cardiac hypertrophy would probably like go away if you, as long as you weren't supplying that same stimulus, kind of just like with our muscles, like, so I know that the heart cardiac tissue isn't like muscle tissue, like there's different properties of it. And your body is going to be a lot smarter about like things like, oh, this is a little bit too big, like we're not having the same stimulus, like we're not going to maintain that size.
and honestly, the risks are not huge. It's not like something like, oh, it will happen now or in 2 months or in 3 months. It will be a long-term process.
Right.
Um, but again, just like right tool for the right job. If there's no need to take them year round, I wouldn't. But they work really well in the situations where you should take them or you could take them. Probably
Mhm.
durations would vary between, I would say minimum duration would be 4 weeks, maybe more like five, and I would probably not take them for more than 12 weeks. Pretty much that would be it. If you look online, you will see some aggressive protocols. I believe a Wolverine stack is 500 BPC every day or twice daily, and 1 to 2 milligrams. So it's 500 micrograms of BPC once or twice daily, and 1 to 2 milligrams of TB500 every other day. And that's a 12-week protocol. And I think there are some other things like tesamorelin or something in there. But yeah, basically, it's a 12-week protocol that is a bit more aggressive than what I would use.
Yeah.
But yeah, and again, people use that kind of willy-nilly, without doing any sort of research on it. It's just like, I saw this on Reddit, so I'm going to do it. And, it's not the end of the world, but I would still advise caution.
Right. I think I wanted to interject one thing too, just because, we're talking about injury risk and prevention strategies. I think the most important thing, to just address here is that, injuries happen as a result of just I used to always use the stress cup analogy. There's, usually a certain amount of stress that your body can tolerate, and that comes in all forms of life. You can be a very, very busy person, have a very demanding job, work like 60, 80 hours a week, only train 3 days a week, and even run into like overtraining, because your stress just is too high. So it's really just about figuring out, how do you manage your own training volume within the constraints of your lifestyle and intensity so that you're not getting, overtraining symptoms. You're not constantly running into joint connective tissue issues, getting sick, like all these little things. And then just really just scaling things towards your own body's ability to actually recover and adapt. And even on PDs, it's just like, in my mindset, it's just like you don't need to necessarily like add more sets or more volume if you're getting stronger. Because and I've noticed that usually for people, it's the same amount of training volume that they were doing that they got stronger with naturally or on sports TRT. They add in, say, a gram of anabolics and they get like 2x the return on that same volume. Whereas sometimes, if you get a little bit too greedy, you might run into, you add too many sets and fatigue gets too high. And I think that's when you run into these issues. Another thing for my powerlifters is that you have to understand that your motor unit recruitment is so much higher when you are on cycle. You are so much better able to recruit your muscle fibers, produce force. And that is also going to cause significantly more stress to your connective tissues. I'd always describe it as like your RPE 8 when you're enhanced is actually RPE 10 when you're natural. And so you need to just really, I think, really managing the average intensity and maybe keep making it a little bit lighter than you might think that you need to. So, maybe instead of, doing a top single, then you do like 3 sets of three, you're natural. You do that, with like a 15% back off. Maybe you really take a 25% off for your back down work. That would be, obviously be helpful, but just, just keep tabs on yourself because in my mind, it's like, when we're in preps, like you mentioned, there are going to be times when you do need to push the envelope and you do need to, just accept that, hey, I'm going into a higher risk territory right now. But we also should be smart with how we're setting things up. If you're a powerlifter, you're peaking, maybe you don't do as many accessories because you know that you're going to have more orthopedic stress from your heavy lifting, and it's going to be also just more stressful on your entire body. So you cut them back. Just about being smart, and then these will come into play. Like Mircea mentioned beforehand, or you're like, oh shit, I'm starting to notice despite that or whatever, like I'm still noticing I'm getting like these connective tissue issues or my muscles are just really sore or whatever it might be, then you can incorporate them as needed, for the rest of prep. But I really like how you mentioned, hey, this is gonna be something that we just take year round. I think that's really important for people to understand because the tendency is like this works. Let's just always take it because it works. And unfortunately that can end in disaster with certain things.
It's funny you mentioned that. It's sometimes I just see people want to take a drug to fix their bad training habits. Like, I want to take Deca because my joints hurt, but do your joints hurt because they're actually beat up, or do they hurt because you train like an asshole and you just need that extra bit of lubrication from Deca so your joints don't hurt while you don't change anything when it comes to your training style. You train way too heavy with pretty shit technique, and yeah, that's probably why your joints hurt. Instead of trying to, go back to the drawing board, lower the weights, improve your technique, improve your execution, maybe change up your exercise selection. You're just trying to patch yourself up. And then you work through the added benefit of something like a DECA or a GH or TB and VPC. And you keep training dumber and dumber and dumber. And at one point, the small things that are keeping you, the small band-aids that are keeping you together will break. And then you have literally nothing. Then,
Yeah.
that's a catastrophic injury.
Yeah, and that's why I think it's so important. When Broderick and Mircea and everyone says you need to come off, like this is like it's not only is it just health wise and just actually like I think part of like the benefit of like going on and off is like also like the appropriate step, the benefit of knowing like I'm on more versus I'm not. I think people get in their head about that, but it's really just to also just troubleshoot um, like what should my training actually be? Because if you don't know how to fucking train when you're natural or on lower dose, you're not going to know how to train properly on anabolics. And Mircea mentioned, just there, yeah, you can train like an idiot for a while, or you can get pretty strong for a while, but there's always going to be this breaking point in everyone's career where like you can't do that anymore. Things need to be a lot more intelligent and methodical. And sometimes like the longer way, and honestly, most of the time, it's just like the longer way is the best way with most parts of just physiology in general. The more you try to rush things and whatnot, it's like you're just going to make stupid choices and set yourself back as opposed to thinking more long term. Like for example, I have some big goals this block. I like to hit these numbers on my meet. I'm like considering my factors of like what I've had to deal with over the past, few years, it's just like, or you could talk a couple years, it's like I can't control that. So like I need to make sure I'm smart with my own training, and I'm respecting my body's limits, and then also with like drugs too. Like if you're taking too much, you're getting sick, like or your body just constantly feels like inflamed. You should cut back. Like that's just my little rant here. I just think that people like to always think that more is more, and especially guys on drugs just like need to hear this because it kind of does attract that type of person that just wants to do like a ton of extreme shit. And it's not it's just it will work briefly, but when you start to get actually strong and actually big, it won't work.
The honest truth is that drugs work so well that yeah, you can actually use weights that can hurt you. As a natural, unless you're really genetically gifted, most weights that naturals use aren't aren't big enough to actually hurt them. If you put an 800-pound bar on your back, that could crush you. That could literally, that could break your bones. So that, just to kind of like caution, yes, gear works so well, but you also need to make sure that training's good, your nutrition's good, and even your pharmacological selection and periodization are on point. Because, and a 200, 220 squat and an 800 squat, they're not the same.
Right.
If you fall with one with that bar, if it's 200, 220, like yeah, whatever. If you fall with 800 on your back, that's going to cause some damage.
For sure. Well, I think we
Mm.
honestly covered everything. Was there anything else you wanted to address about BBC and TB500?
Um, just maybe small like synergies that could work here. I will mention we did mention growth hormone. It works well with the TB and BPC. I prefer actual growth hormone versus the secretagogues like CJC, epimorelin, and um, what it was. I believe MK677 would also be labeled as a GH secretagogue. Well, it is, but you know, I think I tend to think of it more as an appetite stimulant than a growth hormone
Right.
secretagogue. But yeah, I prefer the straight GH. Another thing is for enhanced individuals, estrogen. Estrogen is excellent at promoting joint health and joint healing. So if you are, let's say, taking a TRT dose, sports TRT, maybe on the lower end, push that up to that 3 milligrams per kilogram. Let your body get a bit higher on the estrogen side. That will help with healing. Um, I'm not saying like just, straight up go and take birth control pills or some shit, but let your
Right.
estrogen go a bit higher. Another thing that would help is insulin, and again, for more advanced individuals, yes, you can use an insulin like a long acting Lantus just for that growth factor upregulation to upregulate binding proteins, which will give you higher baseline levels of those growth factors. Or you can naturally increase your insulin production by just eating more carbs. Higher calorie diet, higher carbohydrate diet, higher blood insulin levels. Yes, you might get a bit watery and fat from higher estrogen and higher insulin and higher calories, but you can shed fat. Healing injuries should be a priority. So these would be pretty much my other two synergistic compounds. And the newer one, which is kind of a bit of a fan favorite right now, is the copper peptide, GHKCU, which is a lot of people use it topically. I do find that a um 1 to 2 milligram IM or sub Q dose works pretty well at healing. Um, Connective tissue too, but a lot of that kind of skin tissue, muscle tissue, it's pretty potent. I'm looking into it a lot recently, and I find a lot of benefits to the GHK peptide. So possibly something like GHKCU with TB500 and BPC 157 for, let's say, a 5-week protocol, background GH, background higher insulin levels, whether through more carbs or exogenous, and slightly higher estrogen levels via, you know, upping your testosterone dose or lowering compounds that might inhibit the aromatase enzyme. So that's, without going into details and specifics like this much of this much of that, blah, blah, blah. That's kind of like how I would go about a very serious healing protocol for somebody that, you know, an athlete that has the injury and needs to heal it up fast. For somebody who's bulletproofing himself and, you're in prep, you don't want to fuck up with you don't want to fuck up with your body weight and body composition, especially if you're a weight class athlete. You might not want to, go crazy with the carbs and the estrogen. So for somebody like that, probably more sticking to the growth hormone, the BPC, the TB, maybe also a 5 to 6 week protocol just to bulletproof yourself against injury potential.
One thing I will say there is that if you are not feeling strong and you feel like you're having tons of joint pain, you should have some more water retention on your body in order to be strong because there's a baseline that you'll notice like I love how I look. I'm super dry and my estrogen is like a little bit lower. I look really cool. I'm like, oh, cool, but like my strength is like shit versus like if I'm in that sweet spot of estrogen, and I'm sure I'm sure you aren't saying just like blast it's like ovulation phase, but just like higher for you where like you're actually in a range where you feel good and your training can be supported. We have a podcast all about estrogen, so I think you could go check that out. But yeah, water retention is not a bad thing. It's your friend if you're a powerlifter and you want to stay healthy.
Absolutely. I mean, honestly, and outside of in strongman, Mariusz Pudzianowski, and in powerlifting, maybe a few more powerlifters like John Hack, like Dan Green. Nobody's like bodybuilding shredded in these sports.
Yeah.
Everybody's a bit more watery. Everybody's a bit, has a bit more body fat, and that's for a reason.
Yes, there are some weirdos like me, uh, and Ben Paul when he was at his prime. But yeah, even then, I would probably be stronger if I was a little bit fatter. So, anyways, Mircea, I want to thank you so much for coming on. If, like always, if people want to hire you or join the member site, where should they head?
Absolutely. Members.teamevilgsp.com. We have a free site, which is, where you can find me and all the other coaches, which is just teamevilgsp.com, or the Team Evil GSP IG group at Team Evil GSP. Basically, everywhere you see Team Evil GSP, that's me, that's Broderick, that's our entire team.
Perfect. Well, I'll put that in the show notes. Thank you guys for listening. We'll talk to you in the next one.